If I know I'm going to go with the traditional veneer that's going to be going over the buccal cusp. So, and this is a situation where this might be a patient that has more highly aesthetic issues, where I need to control the incisal cusp tip area, or if it's a grinding habit and I need to manage it from a functional aspect. In a situation like this, where I know that I'm going to need to reduce the cusp tip, I'm going to do that as a second step. The burr that I'm going to use is actually the same burr that we're using for our depth cuts. I'll show you why. This 828.22 burr is 0.3 millimeter depth cut burr, which I love for that. But also when I measure this burr measures just over 1 millimeter in the cylinder height. So that 1 millimeter is perfect for the amount of tooth reduction that I need for the incisal tip or the cusp tip on these bicuspids. So if we look at how I position this burr over the tooth, what I want you to remember that the seating direction of the veneer, because of this elbow that we created there, the seating direction has to come from the facial or from the incisal facial. So the mistake that I see many dentists make in their preparation when they do the incisal reduction, as I turn my model around, is that they'll have the incisal reduction coming down towards the central fossa, so almost tipped towards the palatal. If this is tipped towards the palatal, it's going to make it more difficult for the veneer delivery. So what I want to do is I want to change my direction of my preparation. So my burr is coming from the buccal. So it's going to be coming along this direction and not coming from a lingual direction, which is going to make it more difficult for me to seat my veneer. So I'm going to go somewhere between 90 degrees and 45 degrees, which then will allow me to seat my veneer from a facial or incisal facial direction. So I'm going to drop this burr down about 1 millimeter into the cusp tip here. So essentially I'm taking 1 millimeter off of the cusp tip, and then I'm just going to roll it towards the distal, getting to that distal margin that I created, and then rolling that down again, getting that millimeter reduction off of the mesial aspect of the tooth. So something like this.